This is You Only Know What You Know, a podcast by Compass Health Center about the sometimes messy, always meaningful work of parenting and mental health. I'm Britt Teasdale, a writer, photographer, and parent of 2 young children.
And I'm Beth Hope, a clinician with more than 20 years of experience in youth mental health and a mom of 2 teens. We're here to bring honest conversations, clinical insights, and a little bit of real-life parenting perspective to the table.
Because none of us have it all figured out. We're all just learning as we go, and that's okay. So, Beth, you are a clinician. You're a parent to a tween and a teen. Let's start today with a big question. Why are we doing this?
Why are we doing this?
I don't know. Why are we here? Why are we doing this?
I think, being a parent and being a clinician who historically has worked with children of all ages and families, there's so much overlap and there's so much intersect between the personal and the professional. One of the things, I've been a clinician for over 20 years, and my oldest child is about to be 15. As I entered the parenting space, I kept thinking about the ways that all of this knowledge that I have and all this experience that I have, whether it's from grad school or different work experiences, was going to be so helpful as a parent. And yet, every time I started something new or learned something new in the workspace, I realized I had no idea what I was doing. And I realized there were so many times when either I could use what I was learning and doing to help other people who are coming to me, whether professionally or personally, but that I really was struggling to apply it in my own life because, like the podcast is called, You Only Know What You Know. And I kept finding myself in situations where I would learn something or implement something and think, oh, what I'm doing in work, I should be doing it. And I wish someone had told me this. And if only everyone knew this more proactively. And as I've encountered more experts and more clinicians and more families and parents, I just keep learning. And I feel like we should get the word out there about what we're doing so that more people can benefit and not wait till there's a huge problem. I don't know. What do you think?
I love that. I really, what you said, you learn something in your daily work and then you're like, oh, I wish I was doing that at home, or I wish I'd already known that so I could have implemented that at home before. And I feel like that all the time. My son is 5. I have a baby. And I am learning stuff now that I wish I'd known 5 years ago, right? But you can only do your best with the knowledge you have. And working at Compass, I learn so much every day about mental health. And I try my best to implement some of the tools that I learn here and there. But really, my knowledge base has grown so much. And I would love to share that with that people who are willing or interested in learning. And yeah, really just expanding what we know as parents, as professionals, as friends, as family members, sisters, whatever, whoever we are in people's lives. This information is important. So I think that's kind of the big why.
Also, people constantly are reaching out to various people at Compass, or to people who work at Compass, but from their personal networks, asking for, hey, do you have any resources for this? Or, hey, could you do a training on this? And we get the same types of questions pretty frequently. So we will continue to answer those questions and, host those events and do all of those things. But let's also try this way of getting some of our tips and tricks and expertise out into the community. At the same time, I think we're still learning, and we are always learning from one another, both as professionals in different spaces and overlapping spaces, and from other people's stories. Every time I meet a new patient or do an intake at Compass, or in my other roles, I work at a summer camp as a social worker. I'm do a lot with schools. I'm constantly faced with a new challenge that I haven't thought about before, or a new way to apply some of the things we're doing. So this is, I think, selfishly also for us to stay connected and to learn from one another, because what works for one person doesn't always work in the same way for another. And through this dialogue, I think we will be able to share some of that.
Yeah. And And also, I feel like in this, the world that we're living in right now, we're inundated with so much information, like you said. And how do you weed through what actually is evidence based, what actually is going to help, what actually is, real advice? And I feel like we can bring those experts to the table and share really like what can help. I don't know if you've found yourself in these places, but there's like, the mom groups on social media, and there's so many ideas going around, where you can post up an issue you're having, or, something you're worried about with your kids, pertaining to mental health or not, and you get, flooded with advice from other moms, which is so valuable. But also it's like, what actually is evidence-based? What what should I actually use and implement in a place like this where we're gonna be talking with real experts in these subject areas is, I feel like, so valuable and so important.
Great point. How often do you see someone either asking for a referral for a psychiatrist or just kind of saying, hey, this is what my kid is going through. What should I do? And on the one hand, normalizing that experience and hearing from other moms or
Mhm.
parents, um, like that's really validating, and that advice can be invaluable. At the same time, it can take forever to get in with a psychiatrist.
Yeah.
It'd be really hard to find the right one or someone who can answer specific questions about specific issues. To your point, you and I are experts on certain things, but we actually, for this particular podcast, aren't the experts talking about everything. We're bringing in um, experts who have an incredible amount of wisdom and expertise to share. So, how great that in addition to going to our communities and networking and sharing resources and seeking support through this podcast, hopefully, we got a psychiatrist right here for you, and we're going to answer some questions, and you don't have to wait. Um, I think that's going to be invaluable. I really
Yeah.
do.
And you don't have to be afraid to ask, right? Like, what are the things that maybe you're too afraid to ask someone in your own life, right? But you wanna ask a trusted expert, so hopefully people will feel comfortable enough to ask those questions here, and with our experts that we'll be interviewing. What led you to Compass?
So I'm from Minneapolis, Minnesota, Edina, Minnesota. Um, my life before Compass, I'm the oldest child of four, which tells you a lot about my personality if you believe in birth order, and we're pretty much like that. And I've just always, I actually distinctly remember, I don't remember my college application essay or exactly what it said or what the question was, but I remember very much writing about my fascination with people. Um, and social justice and the importance of advocacy. And so I didn't totally know what I wanted to do. I went to the University of Michigan, graduated, still didn't know what I wanted to do. Decided to go to graduate school, knew I wanted to live in New York. So I did that and went for a social work degree, I think, because it, in my mind, would allow me to work with people in lots of different ways and figure that out and grow. And I'm so glad that I did that. My grandparents are Holocaust survivors. I talk about that a lot. And what I learned from their stories and everything that they shared with me and with the community and with the world in various ways really has shaped what I do as a person and as a professional. And I ended up moving to Chicago because I was sort of done with New York for a time and not ready to move home to Minnesota, and had a lot of friends here, and fell into residential work with children and adolescents and families because I had an old friend from growing up who was living here and doing that work and helped me get a job. And um, I didn't have any idea what I was doing, but it was a really amazing experience. I worked at Mercy Home for Boys and Girls as a therapist and then as a leader, running some of their residential programs for boys, and mentored by a lot of really wonderful people, and found that I really loved working with kids and teens and families who were at risk and at a time when, what's the right word to use? Sort of a higher level of care, if you will. And even though not really they weren't coming to Mercy Home because of significant mental health issues, but because of life circumstances and a need for support. But obviously, whatever they had gone through personally and as a family required support. But getting the opportunity to spend that much time with the people that I was working with, both the staff, but also more importantly, the residents, the participants and their families, I really liked that. And I liked that not doing something where I was seeing someone one day a week and also getting that experience. And so I worked there for a long time and then moved on to the Heartland Alliance, which is a not-for-profit human rights organization. It's based in Chicago, but is international. And there I ended up as the executive director of their child welfare program. So I started by running some of their programs for unaccompanied children. So those are migrant children who come into this country undocumented for various reasons, and running programs that took care of them. They lived there while we found their family members and sponsors and made sure that they were safe and provided an education and medical care and therapy, children from all over the world, and also then supporting some juvenile detention alternative and also homeless young adult programs. So those were residential programs, but again, continuing to want to help people and get to know people and learn from people and people who needed that help and support. I ended up at Compass because I was starting my own family, and in my previous roles, traveling a lot and on call 24/7 and also wanting something new and different growth opportunities. My husband, who's also in the field, connected me with Compass Health Center. Um, and I went there and I'd heard wonderful things about it, but really wasn't familiar with what PHP and IOP even were. Never heard of it, despite all of my years in the space. And just immediately fell in love with the idea of it as a place to learn and grow and give back to my community while still working with people who really needed support. But I have learned so much since I've been here because it was all new to me. I've been here for almost 10 years at Compass as a clinician and then in different roles, started by overseeing the adolescent program and have grown since then. But I don't know, that's a very long answer, not very exciting.
That's great, and I wanna kind of back up a little bit because the through line I feel like is you have been drawn to working with children and teens, it sounds like, throughout your career. It really has been, and I think you said some young adults as well, but really it seems like it's been mostly, children, teens, families. Why do you think that is? Why do you think you have kind of carried that through line throughout your career?
It's a good question. I think I fell into it out of sheer luck when I first moved to Chicago. My focus in graduate school was grief, loss, and bereavement with
Right.
families, death and dying work leading up to and throughout that process. And that is still something I'm very passionate about, but don't do in my professional life. I fell into it and I really just loved it. I started with adolescents, and most of my work has been with adolescents. Um, that particular time in life that is so challenging. I think not a lot of people are drawn to it. It's early enough within the lifespan that, there's always an opportunity to make a difference. I don't want to say that there isn't, but in terms of cognitive development and brain formation and, the different like developmental tasks that people go through at that stage, I don't know. I think I naturally was able to make connections, maybe through my own personality or whatever, with teens. And I just really liked the challenge of it and the opportunity of it. And then, working with teens also means working with families. And
Mhm.
I've just always enjoyed both the challenge and the opportunity of teenagers. And now I have my own.
Yeah.
And sometimes that makes me second guess everything and realize that in a lot of ways, I have no idea what I'm doing at home or at work, but it's fun.
Yeah, it's such a wild time in life. Like, I don't know. I remember my teenage years and just how sure you feel, but how unsure you feel, how everything is changing. You go off to college, nothing is ever the same. It's just it's like, yeah, it's,
I have said this many times. I think being a teenager today, in a lot of ways, at least in Western culture, is a lot harder and different than it's ever been. I can't speak to other cultures, but when I think about social media and the 24-hour news cycle and academic pressures and just all of that, it's a whole other ballgame. And you only know what you know, and they only know what they know. So how can we help them know more?
Wow.
Because they know absolutely nothing, but they think they know everything, and they know a lot.
Yeah.
They and it's love it, and it's certainly not for everyone. So now you tell me what drew you to Compass as a journalist, as a photographer, as a creative, and I've gotten to learn so much and enjoy working from you, but we have very different backgrounds. So how did you land at Compass Health Center?
Very different. Well, I'll kind of start from the beginning, kind of like you did, and we can see what's interesting and what's not. But I I'm from Canada. I grew up in Ontario. I grew up in a small town north of Toronto, really kind of quaint, one of those places where you walk into town and go to the coffee shop and they know your name, like that kind of place. Um, I am the youngest of I'm the only child from my parents, but I'm the youngest of three girls. My dad had two daughters as well from a previous marriage. So I am the baby, but also kind of a single child as well, an only child as well. But I'm very close with my sister who's 20 years older than me. So we have a big age gap. I really kind of fumbled around in high school. I didn't really have a really like I was a good student, but I didn't have like a real passion for anything in particular. And it was when I went off to university and studied journalism that I just like was laser focused into that. I was fascinated by talking to people that I would not normally get the opportunity to speak with through the stories that I was covering, the interviews that I was doing. And I just was able to meet so many different people from all different walks of life. And I just found storytelling to be fascinating, to be able to tell stories. And so that's kind of what I went into in university. And then I went off and it's really hard to get a job in journalism. So I didn't go right into it out of university. I started by working at a domestic violence and child advocacy center, actually. And I worked in their communications office, but I also worked in the shelter on the helpline, answering the crisis line for women who were trying to leave domestic violence situations. And it was really hard and really, really challenging at times, but I loved it. I loved being in the home, taking the calls, having the children who were living there with their moms come in and like sit on my lap while I was like, it was just like this whole thing. And I felt really connected to that. I did that for, I don't know, a year and a half. And then I finally got my first job in journalism. I was a reporter and I did that for a few years and slowly ended up making the shift into marketing and communications. But I think I always have kind of brought that experience and that lens of being a reporter, being a journalist into my marketing and communications work. Um, how do we tell an authentic and a real story is really important to me. And when I learned about Compass, I was actually working for myself. I was freelancing. I was doing freelance writing, photography at the time, marketing, social media, and I was connected to Compass through a friend of mine. I was visiting Chicago at the time, and I actually met someone who worked at Compass at a wedding that I was attending, and they told me about Compass. I was immediately fascinated by the company because I'd never heard of PHP and IOP before. And my family had recently experienced a loss. My eldest sister, Kat, had taken her life. So it was that was also very new. It hadn't even been a year yet. I was introduced to Compass and it just felt like the right timing. I decided to take the chance and move to Chicago. And I've been with Compass ever since. I think it's been 8 years now. So it's been a while.
I can't believe you met someone at a wedding, and that's how this all went.
Thanks for joining us for our intro episode of You Only Know What You Know from Compass Health Center.
We're so glad you're here as we start this journey, exploring parenting, mental health, and all the things we wish we'd known sooner.
Next time, we'll be joined by Compass co-founders and psychiatrists, Dr. David Schreiber and Dr. Claudia Welke. We'll have an honest conversation about what's really going on with teen mental health, how challenges show up, what to look for, and when to reach out for support.
Until then, remember, you're not alone and you're doing better than you think.